Good afternoon. I'm Emily Haynes, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thanks for joining me today. Sarah, would you like to tell everyone a little bit about yourself?
Sure. Hey, Emily. My name is Sarah Muller-Robbins, and I am the Director of Education at the Partnership. So, Emily, I've been excited to plan with you this program that we're having next week on Wednesday at noon, on Wednesday the 9th. So would you like to talk a little bit about the program we have?
Sure. So next Wednesday, I'm so excited to, we are going to have Dr. Caitlin Jedalina, an assistant professor at UT Health and the founder of Your Local Epidemiologist newsletter, join us on Wednesday for a webinar called Weathering the Storm, All Hands on Deck Response to the COVID-19 Infodemic and How We Can Prepare for the Future.
So Emily, I know you've been working with immunization programs since before this pandemic even started. And so what has it been like to work on vaccine hesitancy and things like that for vaccine preventable diseases?
Yeah, it's always been a challenge working with vaccine hesitancy, and I think we really want to try to move the conversation towards vaccine confidence. So how do we help people to understand how safe vaccines are, the safety profile of vaccines, because we're giving them to healthy people, so they have to have an excellent safety profile, and also to understand the risk benefits. So what does it look like when you actually get the disease, and what are the risks of contracting the disease and suffering that illness? For example, a child coming down with influenza versus what are the expected side effects that they might have from an influenza vaccine. So, sore arm, redness or swelling at the injection site, mild fever, things like that. So really helping people to understand what are the risks of getting the disease versus the risks of getting the vaccine, and why getting the vaccine is such a better way to introduce your immune system to this illness and how to protect yourself from it. So there's always been a lot of information about vaccines out there, but I think since social media and on the internet, there's really been people can put a lot up there on the internet, and it doesn't necessarily have to get vetted. So people, we have to really always be sharing good resources with people of this is a website that you could go to get good information about vaccines, encouraging people to talk with their doctor and ask any questions that they have, and then really being able to listen to what people's concerns are and addressing specific concern. And I also think it's really important to recognize that because there's so much misinformation out there, I think it's easy for people to, especially parents of young children, to have doubts or have a hesitation. Is this the right thing to do for my child? And to be able to reassure them that this is something that's really important that they can do to help protect their child from a really serious illness. COVID-19 is now a vaccine preventable disease for everyone 5 and up. And so the way that I look at it is if it's, if any suffering or illness or hospitalization or death is preventable, we want to do everything we can to prevent that. And vaccination is really the most effective way that we can do it. So all of that has always been my approach to providing vaccine education. And with COVID-19, I try to take a similar approach too.
Yeah, that makes sense. In Dr. Jedalina's talk, in her title, she has the term infodemic. Can you explain what that means?
Sure. So an infodemic is basically just so much information coming out during a disease outbreak. And that's good information. So studies being shared, scientific journal articles being published, and also misinformation and disinformation. And so, misinformation is really when you see something maybe on Facebook or online and it's not quite right. And maybe you you read that and you share it with someone else, but your intent was not to hurt that person. You just shared something that you saw. Disinformation is intentionally putting wrong information out there to cause doubts or fear for people. So an infodemic is basically when you have all of this information coming at you during a disease outbreak, and it makes it difficult to navigate as a person that wants to try and do the right thing to keep themselves and their family healthy. Maybe, you know, you hear one thing from your doctor, one thing from online, one thing from the grocery store clerk while you're checking out, one thing from a friend. And who do you listen to? How do I know what's true? You know, how do I navigate all of this, information? So that's what an infodemic is.
Yeah, I can relate to that. And, you know, even for myself as a nurse, I was working in the hospital when the pandemic hit, and it was scary. And I felt like I wanted to have information. The information I was getting was just a lot of illness, and it just was a scary time in the hospital as well as everywhere in the public. And so I felt like my initial response was, I just want to take my family and go in a cave and not come out for a while. But then I realized, you know, it was based on fear, and wasn't really based on fact. And so that was when I came across your local epidemiologist newsletter, because she really took all the latest studies and the information that we have and presented it in a way that I could digest, you know, when I felt like you described, the infodemic, when it was just overwhelming. And so that her newsletter really helped me to get through and to be able to use facts rather than emotion to make decisions for myself and my family, and for those who are immunocompromised in my life, to make sure I'm making the right decision for us. And I know that you said you've been following her for a while, and even when you announced that she's coming to speak next week, a lot of our colleagues at the partnership said, "Oh, I've been following her," and I was surprised. I learned recently that, I mean, it's been a couple months, but she had 1.6 million followers throughout 166 countries, I believe it was. So she's got a huge following. She really seems to have tapped into a need in the public to really understand, you know, the science and the facts and what we know and what we don't know, to make the best decisions. And so I know you're getting her newsletter as well. Have you seen recent ones? And she's had a couple this week that have come out.
Yes, I also follow her newsletter, and it's been so helpful for me personally and professionally, to help navigate this pandemic and all of the information that comes out, you know, new studies that are coming out, what you see on the news. What does that really mean for me trying to keep myself and my family and my community healthy? And how do I present that to people so that they can help understand that information too? So it's definitely been valuable for me. Yes, I saw Dr. Delina put out her newsletter, I think it was last night, on the new vaccines that have been coming out. And so the World Health Organization has really been looking at, you know, how do we end this pandemic? We need to get about 70% of the world's population vaccinated if we have a chance of really stopping new variants of concern from coming up and doing what, for example, Omicron has done, which has, you know, created another surge. So her latest newsletter talked about the Novavax and Corbavax vaccines, which really use more traditional vaccine technologies that require less storage requirements for vaccines than some of the other COVID-19 vaccines. So that means that they're more easily used in, you know, low-income countries, in more rural areas, where it's difficult to maintain what we call the vaccine cold chain. You have to keep vaccines at a certain temperature, depending on how they're made, for them to stay usable. And as you can imagine, in the more remote communities, the further out you go, the longer it takes to get the vaccine there, and the more challenging it is to maintain that cold chain. So vaccines that don't need to be stored at very low temperatures do a better do better in that cold chain for remote areas. So these two vaccines are really exciting, and it's very good news for the pandemic because they can be used throughout the world in some of those more remote communities. And we are very familiar with how these vaccines are made. Also, it's same technology really as like the hepatitis B vaccine that most of us have received. So, and then they have less side effects as well. So it's exciting news on the vaccine front. And I always, every time I get a newsletter from your local epidemiologist, I'm always excited to open it and learn something new that day.
And just learning how what's happening across the world impacts us right here in Northern New Jersey, I think is fascinating and important to think about.
Absolutely. I think, you know, even before COVID-19, when we would see things, unfortunately, like a measles outbreak a few years back, we had a local measles outbreak in New Jersey. You think about when vaccine coverage rates get to a certain point, it's really only a plane ride away, the next disease outbreak. And so we have to think about, you know, diseases don't, you know, just stay in one spot. They travel with the host. And so if the host is jumping from country to country, that's where the disease is going to go to. So we need to kind of have a global approach if we want a chance to end this. So Sarah, what do you think that attendees can expect to take away from next week's presentation?
Yeah, I'm really looking forward to it. Dr. Jedalina said that she will be able to speak about what she's learned over the course of this pandemic, where she has really worked at taking the science and kind of what can get pretty complicated and translating it so that the public can truly understand it, as well as the best ways to fight misinformation when there's so much misinformation out there as well. And she also said that she'll be addressing about how to take these lessons and apply them to the future. Because unfortunately, I don't think even once we're past this pandemic that these issues won't continue on. And so I'm looking forward to learning from her to see how I, as a healthcare professional, as well as just a community member, can learn from what she's done over the last almost 2 years and apply that as we move forward. So I'm really looking forward to it. You'll be moderating the discussion, and she will leave some time at the end for questions and for a little Q&A. Are there any questions that you're looking forward to asking her?
Ooh, yes, many questions. I need to make sure that, you know, I give preference to all of the audience members to ask their questions also, or else I could just take the whole time to ask my questions. But yes, definitely. I mean, as you know, I have 2 little ones under 5, so there's not a vaccine approved yet for COVID-19, but the latest news is that it may be coming. And Dr. Jedalina actually had addressed this in a recent newsletter edition that she put out about what we know and what we don't know about the vaccines for children under 5 and what that possible timeline looks like. So I know she's also a mom of young children, and I think, you know, I would like to know personally and professionally, but mostly personally, you know, how will she make that decision? How will she know that, yes, I feel comfortable, you know, giving this to my own children? And, you know, how do we sift through that data to make that decision as a parent? So I'm definitely, if I can get it in, I'm definitely going to ask her that question, and I'll be eager to hear that answer. How about you? What question would you like her to answer?
I think, you know, my kids are school aged, and when can they take off their masks, and is that the right thing to do? And when can we act like it's normal again? And, you know, what's the chances of a next variant coming in, like you said, and acting like Omicron again? But even more so, how can I be better at communicating, you know, as a nurse, as a public health professional, at communicating the facts amongst this infodemic? So I'm really, really interested in hearing what she's learned. So yeah, I think it'll be great.
Definitely. I'm so excited. And for those that can't attend on next Wednesday at noon, that's when the live presentation will be. how are they able to access it? How are we handling registration for this event? Because it's a special event. I know we already have a huge registration, and I know registration is still open. So how can people view this?
Yeah, there's a huge interest in this topic. I think it really is addressing questions that so many of us have. But so many people who do want to attend are unable to take a break at lunchtime to watch. So what we're able to do is, for everyone who does register, they will get an email, whether you were able to attend live or not, get an email with a link, and you'll have access to the link for a full month after the live presentation, so until March 9th. So we encourage everyone to register so that they can have access to it, even if they can't attend live. It's geared towards healthcare professionals, but it really is information that everyone in the public, everyone is dealing with the effects of this. So everyone is welcome to attend. So for anyone who does want to register, they can go to our website at www.pmch.org. And if you click on the professional education tab and then the virtual programs, there's a list of virtual programs. That's the next one. We have some other really great programs coming up after it as well. And so that's a great place to register. So we hope that a lot of people will be able to join us. I'm looking forward to it, and I know you are as well. So thank you so much for taking the time to discuss this. And I always learn a lot from you when it comes to vaccine preventable diseases, and I know that will continue on. So thanks so much, Emily.
Thank you, Sarah. I'm so excited to work with you on this too, and I can't wait for Dr. Jedalina to join us next week at the partnership. And I hope that you have a great weekend. Thanks so much for everyone that joined us today to watch this, and I hope everyone has a great weekend, and we'll see you next week.
Stay warm. Thanks.